Bismillahirrahmanirrahim. Today we will discuss miscellaneous condition of nose and paranasal sinuses. So miscellaneous condition include various situations like foreign body in the nose, like maggots in the nose, and granulomatous conditions, and fungal infections of the nose and paranasal sinuses. So first of all, there are granulomatous diseases of the nose and the paranasal sinuses. This is the list of granulomatous disease that is including simple chronic infections and also the fungal infections and some autoimmune diseases. So important topic is rhinoscleroma, that is caused by gram-negative infection, that is Klebsiella, leading to lot of formation of crusting inside the nose and destruction of the mucosa of the nose and paranasal sinuses as well as bone, leading to crust formation, and it can cause atrophic rhinitis later on. Atrophic rhinitis is the condition in which patient will complain of anosmia, and there is lot of bad smell will be felt by other people because of this crusting and gram-negative infection. So treatment of this condition is first of all you will diagnose the condition. You can diagnosis depends on history and clinical examination. On clinical examination you will see lot of crusting and greenish material coming out of the nose, and there may be history of epistaxis because whenever crust will get separated from the mucosa, it will cause bleeding. So 100% diagnosis will be made on histopathological examination and culture sensitivity test, and treatment is given is as we will treat the infection. So streptomycin and tetracycline are given, and duration of the treatment should be more than 4 to 6 weeks, and you have to clean the nose with the help of salinase nasal drops or nasal douching with the help of soda bicarb and other things. You can use glycerine to make the nasal cavity soft. Tuberculosis is very important chronic infection. Tuberculosis in the nose is usually seen as a secondary infection after the pulmonary tuberculosis. And difference between tuberculosis and other type of chronic infection is that you will see caseating granulomas in tuberculosis. Patient will present with all the signs and symptoms of tuberculosis. What are these signs? There may be low-grade fever or evening rise temperature, night sweats, and anorexia, loss of weight, and there may be chronic cough. And when you will examine the patient, there may be history of epistaxis because of these granulomas and nasal obstruction. Patient might present with nasal obstructions and epistaxis. And you will examine the patient. There will be granulomas in the nasal septum and lateral wall of the nose. And usually in gross examination, there are apple jelly nodule are seen. And you can also do culture sensitivity to diagnose the case, and after removing the mass or these granulomas, you can send it for histopathology. Histopathology will show caseating granuloma, that is differentiating point, and after diagnosis treatment will be anti-tubercular therapy, that is usually given for 9 months in this case. Another condition is syphilis. Syphilis is also comes under the heading of chronic infections. Chronic infections of nose and sinuses are syphilis, tuberculosis, and leprosy. All these will cause formation of granuloma inside the nose, and all these three infections will cause destruction of the bony part of the nasal septum. So whenever you are asked about what are the causes of perforation of the nasal septum, so you will have to write these chronic infections. In other causes of perforations are trauma, that can be idiopathic, that can be surgical trauma. So you have to write all these conditions. Toxic cause of septal perforation is cocaine addiction. People who are using cocaine or cocaine sniffing, it can cause perforation in the perforation of the nasal septum. Syphilis is a rare disease nowadays, and it is caused by spirochete infection. And nose will be, it has 3 stages: primary, secondary and tertiary stages. So nose will be involved in the late stages, it means in the secondary and tertiary stages, and it will form granulomas inside the nose and will cause destruction of the bony part of the septum. Bony part of the septum is mainly made of humor, so there will be destruction of the humor and perpendicular plate of ethmoids. Diagnosis will again depend on history, clinical examination and investigations. On history, there may be history of epistaxis, there may be other lesions of syphilis on skin and another part of the body, and then on clinical examination you will see granulomas and infection inside the nose. So that is the lesion caused by spirochetes. And then you can take culture sensitivity, and you can send biopsy for this infection. Culture sensitivity will tell you about the spirochete infection. And other serological tests are VDRL and other serological tests for syphilis can be done. That can give you idea about the syphilis infection. And treatment, I have told you that only benzyl penicillin, injectable penicillin is given for the treatment of syphilis and diphtheria. Today's we can give oral antibiotics and parenteral IV injections, but benzyl penicillin, injectable penicillin is really given in cases of syphilis, diphtheria, and whenever there is infection of the brain, encephalitis, and you are using penicillin, it can be given in injectable form. In other diseases, we can give oral form of penicillin, that is amoxicillin, ampicillin, and amoxicillin. We can give this infection. And then when you have treated the infection, you will treat the perforation of the patient. So whenever there is small perforation, you can ask the patient to clean the nose, and small perforation can be closed with the help of flaps. Whenever perforation is large, you can give surgical treatment to the patient with the help of flaps, or you can also use nasal buttons. Nasal buttons will block the nasal perforation. And the sign and symptoms of nasal perforation are usually lot of crusting, and when there is small perforation, when patient breathes, there will be whistling sounds. Patient will or the people can complain of there are whistling sounds in his when the patient breathes. So treatment of small perforation is usually cleaning of the nose, and large perforation whenever there is obstruction and epistaxis, lot of crusting, we treat the large perforation with the help of flaps or nasal buttons. Another thing in diagnosis is direct examination. So we can stain the spirochete, and we can see these spirochetes under direct microscopic examination. In cases of syphilis, direct examination of spirochetes is very important. We will send the specimen, and we'll ask the pathologist to stain the spirochete with the help of, I think, silver nitrate. and we can examine this spirochete under microscope. That will give you immediate diagnosis of the syphilis. Now we come to the fungal infections of the nose and paranasal sinuses. It includes rhinosporiasis, aspergillosis and mucormycosis. Rhinosporiasis is usually seen in lower socioeconomic groups, and patient will present with nasal polyp that can be mixed with enterochoanal polyp. So complaint of the patient will be unilateral nasal obstruction and unilateral epistaxis. And diagnosis is made when you will send the specimen for histopathological examination. They will show you that it is the fungal infection with spores and fungal hyphae. And you can send the specimen for culture and staining for the fungus. They will also show that there is fungal infection. So treatment is excision of the polyp and antifungal medicines. Aspergillosis is fungal infection. It usually involves the maxillary sinus, forming the ball, fungus forming the ball in the maxillary sinus. It is called aspergillosis ball or fungus ball. And treatment is usually seen in farmers, and it is seen in patients which are not immunocompromised. These are the healthy patients with exposure to the grass and other things, and they can cause aspergillus infection in the maxillary sinus. Treatment is again removal of the fungus from the maxillary sinus with the help of endoscopic sinus surgery and cardiovascular surgery. And if there is invasion of the fungus, then we will have to give antifungal, parenteral antifungal medicines. Then mucormycosis is another important infection that is usually seen in immunocompromised patients. Most important disease that is usually seen in our country is diabetes, causing in patients will have low immunity. So mucormycosis is the fungus that involves the patients who are already immunocompromised. So it is usually seen in patients with uncontrolled diabetes. Another condition that is seen in diabetes is malignant otitis externa. We have discussed it with diseases of the ears. So in this patient, mucormycosis is dangerous infection. It can easily invade the mucosa and the bone. Usually it causes the destruction of the medium and small vessels, and there will be lot of necrosis inside the nose and sinuses. It can invade the eyeball, it can invade the central nervous system. So it can invade all the tissues surrounding the nose and paranasal sinuses. It can also involve the palate and can appear in the oral cavity. So treatment again is control of diabetes, debridement, surgical debridement of all the things, and amphotericin B, that is parenteral antifungal, that is really given in this patient to save the life of the patient. So it is very dangerous disease. Now we come to the autoimmune diseases of the nose and paranasal sinuses. Wegener's disease. Wegener's disease is also granulomatous disease. It is autoimmune disease. It can cause formation of granulomas inside the nose, in the lungs, and as well as in the urinary tract. So patient will present with epistaxis, problem in breathing, as well as there will also be hematuria. So if patient with epistaxis and hematuria, usually you should have to rule out Wegener's granuloma. It involves the small and medium-sized vessels, causing necrosis of these vessels, and there will be decreased blood supply to the mucosa and bone of the nose and paranasal sinuses, and there will be non-caseating granuloma. Then the patient will present with epistaxis and destruction of the kidney and urinary tract. There will be hematuria, and on chest X-ray there will be wedge-shaped necrosis of the lung tissue. Patient can also have hemoptysis because of this necrosis of the lungs. Treatment is again, first of all, diagnosis made by history and clinical examination. History will be low-grade fever and anorexia, that is really seen in autoimmune disorders, and there will be history of epistaxis along with hematuria and hemoptysis. And when you will examine the ESR of the patient, it will be raised. And the test that is confirmatory test is Mcqs antibodies, that is anti-nuclear cytoplasmic antibodies will be raised in these patients. And treatment is again, as we will give steroids in autoimmune disease, so steroids are given. Anti-cancer medicines as a thiopurine can also be given to lower the immunity of the patient. So these patients you might get some MCQ from this. So anosmia is the loss of smell. Complete loss of smell is called anosmia, and decrease in smell is called hyposmia. There are different causes of loss of smell. As I have told you, always whenever you get a question about causes of something, you have to write congenital causes and acquired causes. So sometimes anosmia is congenital. So the other causes may be trauma, tumor, obstructing or destructing the olfactory nerve endings, and there may be trauma of the base of skull, and trauma can be iatrogenic, and that is a surgical trauma, and sometimes there are viral infections destructing the nerve endings can cause this anosmia. And sometimes toxic causes, patient inhaling any gas and any toxic material, or sometimes cocaine abusers might have this anosmia. And it can be age related. In late ages there is necrosis of nerve endings leading to anosmia. So there are different causes of anosmia, and sometimes the most important cause is idiopathic. Sometimes there is you can't find any cause for anosmia. So treatment is only to rule out any dangerous disease, to rule out tumor of the nose. Sometimes there is fracture of the base of skull. You have to rule out important that are the dangerous causes. And if you have found out these causes, you have to treat these causes. Otherwise, there is no treatment for anosmia. And if patient is having some autoimmune disease, or there is immediate loss of smell, that may be due to some inflammation. So you can try steroids to reduce this inflammation for idiopathic cause. So sometimes when inflammation decreases, patient I think there are some medicines that can cause temporary loss of smell, such as betnisol N drops containing neomycin. Neomycin is the drug that can cause hyposmia and anosmia. So you have to ask the patient to stop this medicine, and otherwise there is no treatment for anosmia. Now, perforation of the nasal septum, we have discussed it, that perforation can be small and large, and treatment is usually surgical, or you have to ask the patient to live with this, and you have to ask the patient to clean his nose and remove the crust from nose. And treatment, I have told you, that may be surgical or nasal buttons for this disease. Now, what are the synecdoche? Are usually the adherents, fibrous bands inside the nasal cavity. So cause may be iatrogenic. Iatrogenic means when you are doing some surgery and after healing there may be adhesion formation inside the nasal cavity. Sometimes nasal trauma, if you are not splitting, you are not keeping the splints inside the nasal cavity, so there may be adhesion formation. Chronic infection of the nose can disturb the mucosa of the nasal cavity and can lead to formation of the adhesions or synecdoche. So the treatment is always surgical for adhesions removal or synecdoche removal. So surgical removal can be with the help of knife and cautery, and the latest treatment is laser treatment. Through this laser we can remove these adhesions, and after removing the synecdoche we have to place certain kinds of nasal splints to prevent further formation of this synecdoche. Now another important condition is foreign body nose leading to formation of rhinolith. Foreign body nose, you might get scenario from this foreign body nose, and foreign body can be organic and inorganic. Organic foreign bodies are more dangerous as compared to inorganic foreign bodies, because organic foreign bodies means peas and corn, they will cause, and peanut, and they will cause lot of inflammation inside the nose. Patient might have epistaxis due to this inflammation. And inorganic foreign bodies are like beads and paper and rubber. These are the inorganic foreign bodies. Organic foreign body also include the maggots, that is the larval stages of the housefly, and it is organic foreign body, that is also dangerous. So patients are usually children or psychiatric and mental patients, but most of the patients are children. And patient, if child's mother or father knows that patient has something inside the nose, they will tell you that he has put rubber or anything organic material inside the nose. So the history is very important. There will be history of inserting something inside the nose. Sometimes if in late stages child can present with nasal obstruction and unilateral rhinorrhea, and unilateral rhinorrhea will be pus, foul smelling pus coming out of the one side of the nose. Usually it is unilateral, but it can be bilateral. Patient can insert things in both sides of nasal cavities. And sometimes if patient comes to you very late, this foreign body can act as a nidus, and there will be a lot of salt, calcium deposition around this foreign body. It becomes thick and just like stone. It is called the rhinolith of the nasal cavity. So rhinolith is hard. When you will do probe test, you will touch this rhinolith. It will be hard, and you can see that it is covered by whitish material, that is really calcium salt. So treatment is again depends on diagnosis. Diagnosis based on history, clinical examination, and investigations. Metallic foreign body can be seen in the X-ray, and if the foreign body is metallic, you can see that it is inside the nose. And treatment is removal of this foreign body. In cases of rhinolith, it is difficult to remove because it gets impacted inside the nasal cavity. You have to break this rhinolith with the help of some instruments, or in removal of foreign bodies with the help of instrument that can be probe, that can be for SIP, and depends on the type of the foreign body. And rhinolith, if you have tried once and patient is not very cooperative, then this foreign body should be removed under anesthesia, general anesthesia. And rhinolith is usually always removed under general anesthesia, because you have to break this rhinolith with the help of some instruments. So you will break this rhinolith and you will bring out in the form of pieces. So patient history is very important, and if child is not cooperative and someone has tried once, so you should remove this foreign body under general anesthesia. Maggot of the nose is also very important. You might get question in your MCQs, and it is usually asked in your vivas. My maggot are the larval stage of housefly. It's usually seen in very sick patients, in patients with chronic diseases like tuberculosis, leprosy, and patients with tumors of the nose and paranasal sinuses that are sick. So these housefly lays eggs inside the nasal cavity, and these eggs these housefly lays egg inside the nasal cavity, and these eggs hatch, and larval stage comes out of the eggs, and it will cause severe inflammation of the nasal cavity. So patient can present with epistaxis, itching, and these larval stage or maggots can enter into the eyes of the patient, as well as they can penetrate inside the intracranial cavity, causing encephalitis. So it is usually seen in very sick and debilitating patients. Treatment is the maggot oil. You will instill the maggot oil, that is the combination of turpentine oil and chloroform, and it will choke the respiratory system of the maggots, and also make them unconscious, and then these maggots will be removed with the help of suction and forceps. If we are crushing these maggots, it can lead to severe inflammation, and this can cause anaphylactic reaction. So they should be removed with suctions and with the help of forceps.